Hey y'all.
Hey everybody.
Through the healthcare system. And what that meant was needed to be, and sometimes still needs to be, a diagnosis of like gender dysphoria, or like diagnosing somebody as transgender in order to like meet the needs that they're coming to the healthcare provider with. So that like definitely like bleeds into the sexual and reproductive healthcare system. That they're like, when a trans person is coming into a doctor's office, there's an assumption, like if it's known that they're trans, there's an assumption that like there's something wrong with them. Yeah, and so I'll let other folks maybe like answer from there, but I think that's like an overarching like pathologization is definitely a barrier.
Building on what Courtney is bringing attention to, one of the issues that we have at our clinic is that the staff and the providers just aren't educated when it comes to any LGBTQ healthcare. I'm very lucky and very fortunate to work in a clinic that where the providers that I specifically work for utilize trauma-informed care. They make an effort to learn and be open, and that's one of the things that our main provider, Dr. Justana Cooper, always says is, I want everyone to feel comfortable coming to get care from me, but I need people to understand that this is not something, that I was ever taught while I was in med school, and I'm learning, and it's going to take me a while, and I'm going to do the best I can. But I will mess up, but know that I'm going to do my best to learn and move forward. So I think I'm really lucky, and I'm in a unique place to work in that regard, but that's to build on everything Courtney has been saying. Yeah, I think that's a huge barrier.
So I definitely agree with both those points that it's culture, pathology within the stigma. I definitely would say, though, that we need to even back it up further than that. So when we look at this issue, we are all around, it's a cultural stigma issue. It is feeding into every part of what transness has an impact of how this affects your life, your basic, just like well-being, standard, just human decency of life. So then when we look at southern regions and look at these states that are having these obscene heartbeat and like trying to roll back just the standard that SCOTUS has already set, and we think about how does that affect cis women, right? And so how does this affect cis white women? And we look at like the people who are really the least sort of experiencing issues in this arena of care. And then we look at, they're still experiencing issues in this arena of care. And so then we back it up again and say, how does this healthcare arena look like to a BIPOC person? Like, not even with the transness. And we look again, and that disseminates into another arena of issue and obstacle of what that stigma looks like. And then you boil it down once more, and you look at it from a transness point of view. And you have all of these other issues. And then we know, just like BIPOC people have issues of disparity and just basic income to be able to access, when you look at what does this look like even in a micro municipal level? Where are these clinics? Where are the providers? What is the access? What is the transit for somebody that doesn't have a vehicle, that is in a place of dire need? And if they need abortion care, what does it look like? We have had we connect trans folks who are in need of abortion care with organizations who, from the transportation to the assistance with coverage for the actual procedure, we have done everything we can to collaborate with them, to network, so they know, like, when we're like reaching out and we say, here's the deal, that like we're taking a lot of that stress and anxiety off of the person who is in a place of, oh my God, I am in this place, this is the decision I have to make, but then like, what does it look like for access? And I think that is a starting point of, if you can't even get the people into the places, and then once we get into the places, the pathology then comes into play, where I'm gonna assume, you know, if I go into a sexual health appointment at an OBGYN, and I'm sitting there in the waiting room, there's already this like issue, right? What does that even look like on the very fundamental? How do I check you in, and how do I ask you to come back to be seen without all of these like people who are also there for this very particular kind of health, looking and being like, what's going on? And so I think like, when we come to it, people, especially when we're more well-versed into it, we forget these like foundational, just stepping stones to even be at the place. And so I think that is the unique part that we have here, right? Is that we have to backtrack even more in an issue of reproductive justice that's already a hard-pressed issue to address this. So hopefully that helps, and I hope I'm clear enough here.
Well, and with what you're saying too, Emmett, like the getting the people to the place, like we know that trans people disproportionately live in poverty in comparison to cisgender people. We know that transgender people disproportionately are Black and Indigenous and other people of color. So we know that like for cisgender women living in poverty or living in rural areas to access the clinic, like exactly what you're saying, and trans people are even more likely to have to face those challenges. I think another piece of it too is trans folks wanting to go to a clinic, because whether it's abortion or a pap smear or STI testing, like trans and gender nonconforming folks either know from firsthand experience or from the people in their lives, or because everybody knows in the world, even transphobic people, how poorly trans people and gender nonconforming people are treated. And so there's like a fear and a resistance to even wanting to go to an abortion clinic, to even wanting to go to the gynecologist, because, and then there's like more layers to that too, because like some folks, as there are cisgender women who experience pain and dysphoria during pelvic exams. This is an issue for our community too. Like there are like trans and gender nonconforming people, not all trans and gender nonconforming people, but some experience body and gender dysphoria. And like that affects whether or not they want to go get a pelvic exam. And there's a lot of, and so like that's one piece of it, but also like coming back to the piece about the discrimination and like violence that trans and gender nonconforming people have experienced in a doctor's office with a doctor, very rightfully so, makes them not want to go into those clinic spaces. And everybody has their own like boundaries, but like for some folks, they're like, I need an abortion, but I'm not going to go into a clinic. Because I like hate the healthcare system. It has hurt me. It has hurt my body. It's hurt my soul. I'm not going into an abortion clinic. And that's when like self-managed abortion and like community care networks of queer and trans folks taking care of one another in their homes is like beautiful. But like that's also like another piece of like, yeah, it's a barrier to get people there, especially when they're experiencing poverty, and especially when we live in states where like if they're seeking an abortion, for example, there are so many restrictions already to accessing abortion care, like gestational age you have to consider. The wanting to go is like another piece of it. And sometimes people are pitted in this like desperate decision of like, I'm experiencing a pregnancy crisis. I hate this system. I have to engage with this. Maybe I have to engage with this system in order to get this thing that I need. And so unfortunately, and this is what I think is like bullshit and we've got to do better, people are having to triage their needs. They're like, okay, I need an abortion, so I'm just going to put up with being misgendered for these 2 appointments that I got to go to in Alabama in order to get that abortion. And they're having to make those types of decisions, and like people shouldn't have to make those types of decisions.
Thank you all so much. Just a reminder from our interpreters to please try not to use acronyms and instead list out the entire word. So moving right along, we know that sexual and reproductive health care is already a highly stigmatized sector of the healthcare system. How does this stigma affect trans, non-binary, and gender non-conforming folks differently than cisgender people?
So in Texas, I would say TEN's probably one of the first organizations to step out into the reproductive justice area within the intersection of what we do. The first pushback that we actually came from trans people, very specifically older white trans women who very strongly voiced to me that they were pro-life and they did not think this was a trans issue. They very hard line came against us. Actually, we lost a lot of support of that had been there previously, the better part of the decade before I came on. And so I think like one thing is that stigma that exists within cisgender culture, it is alive and well. Like we manifest a lot of the ills of the like greater nation that we face in our own unique ways when people actually start to understand who we are, who our community is, and what does this look like for us. And I think folks have this assumption that trans people are not going to necessarily have that same stigma about like this issue, but we certainly do. Just like we have an issue of racism within the trans community, just as much as the rest of the nation does. We have an issue with these other sort of intersectional issues that intersect just very deeply into like the health, and especially when we're talking about, assigned female at birth, trans and non-binary people, that is a very different conversation, even within that group. So for me to go through this and need, abortion care is a different conversation than I think even Courtney would have with a provider. And so that nuance, but like there's still very like mainline components, right? Of like, what does it mean to be trans or identify on the gender spectrum in not a way of your typical like cisgender framing. And so where we have a huge issue, in my opinion, is we have a lot of trans guys who have like gotten our health information from Google, which like hit or miss, right? But now we're in a situation where, and I believe somebody even said this on the chat earlier, where it is very typical for trans people to be walking their medical care professionals through their healthcare, and that is not the way it's supposed to be. So then we go back to, where has funding been? That funding is a big part of like, how do we learn more about how to do this better in a medical arena, where you have to have like data and science and research backing to understand, to navigate how to treat people well, through a patient-centered kind of approach. And so when we're talking about that, it's complicated. I think it feels overwhelming for providers sometimes. I know, like, especially I do a lot of work with like talking with doctors and things like that about an array of things. And it's an uncomfortable thing for them to have me, who is absolutely not an MD of any sort, giving them information that does connect with their knowledge, their expertise, their medical knowledge. And they're, I think, frustrated too of like, how were you able to piece that together? And we're still dealing with, how do we do this? And so I think, you know, that is a unique situation very much within the trans community, where we have patients holding our doctors' hands for just basic care needs. And so then when you talk about abortion care, think about like an abortion provider who has not been giving abortion care to somebody that looks like me. And I come in and I say like, I need this care. And like, even just the knee jerk of looking at me and being like, you what? You know? And here is the problem, you know?
Yeah, just to kind of build off, Emmett, what you're talking about, again, my point of view comes directly from the providers that I work with, who are working more and more with trans individuals than they were previously. And I think it's just simply word of mouth. They're hearing that there's one other clinic in Birmingham, there's one other provider, right, who is willing to work with folks and, to your point, piece this care together. And I think for the care provider I work with specifically, it's an exciting opportunity to learn that she hasn't had in a while. And so, you know, very compassionate provider, very wanting to learn, wanting to be the best kind of provider, but it's still, she's very, every time we have someone come in, she's like, I just don't understand why people want to work with me, because you know, I've never done this before, and kind of reassuring her that this is, people have heard about how you're compassionate in the other areas of your practice, and that you're genuine and you're working on this education for yourself, and then it becomes a community benefit, right? So yeah, just building on what you said, Emmett.
And when you were talking about trans folks having to teach their healthcare providers, that's something that like I heard a lot in the work that I did around abortion support. And something that I learned that is like an issue with that, like, of course we should not have to teach our healthcare providers what we need, but like, we also, because the world is transphobic and like we're never taught about our bodies in a way that's affirming when we're growing up, we also like don't entirely know what all we need. So for example, like there's a lot of data that shows when folks are getting prescribed testosterone, like not always the doctors that's prescribing that to them are having conversations with them about birth control and how the use of testosterone is not a birth control method. And what we find is, especially in younger folks who are like starting to have sex and who are going on T, you might stop having your period for a while, or like might have it intermittently. And some people might be put on birth control or might go on birth control, and some folks might not. But what the data currently shows is that doctors aren't having that birth control conversation with people when they're putting them on hormones, and because there are like these assumptions about trans folks that like, I don't know, like that they're asexual, or that like because of like the gay framing, it's like a same for same, like, oh, they're not like, and when they're thinking same for same, they're thinking like same like external sex characteristics for same external sex characteristics. So like these people aren't going to be pregnant. And what they don't understand is that like that's not the world that trans and gender nonconforming folks navigate. Like it is so diverse. Like you can't come into a clinic and like, for example, like me come in and say I'm a lesbian, and the doctor make an assumption about my sexual behavior and think that I'm not at risk for pregnancy or HIV or anything else, because that does not mean that I don't have like penis to vagina sex because I'm a lesbian. And so what I'm getting at is then we have people who don't fully understand like birth control, and that testosterone is not a form of birth control, and so they can still get pregnant. And in the worst of situations, because that's not an expectation and they're not tracking their period because they're already not having it because they're on T, they can end up being pregnant, and it might be a while before they know that they're pregnant because they're scared of healthcare providers. They don't feel comfortable going to family planning clinics, and maybe they're not attuned to like the symptoms of pregnancy. So then you're risking increasing your gestational age. And we know in the South that affects that's a huge thing that affects your ability to access abortion care. So there's this whole piece of like, we should not have to educate our healthcare providers, but there's also this piece of like, we don't know what we need. And like, that's not our responsibility. That is on our healthcare providers to not make assumptions about the kinds of sex that we're having just because of our gender identity or because of our sexual orientation. Like those boxes are more and more just really irrelevant to like people's actual sexual behavior.
Yeah, I definitely agree on that. One of the things that I've been talking about and trying to just impress upon people within the especially HIV advocacy arena is that I really truly believe the next wave of crisis is going to be through Black trans men getting infected with HIV, especially Black trans men who are whose sexual orientation is gay, because they are having exactly the kind of sex that puts you at the highest elevated risk for infection. And then on top of it, you have all of the stigma and the issue that we're talking about today within sexual health, within reproductive health. And because then you also look at, how does being an ethnic minority, how does being Black in America also affect this healthcare? And how does it affect look at the outreach right now. Like any Gilead ad is like, there is not anything that really points towards like the HIV sort of arena in the big players of even recognizing that this is a huge issue. This is high risk. Like this is everything that we talk about, and they know all this, but it's like they just can't connect it. And so I think when we talk about this too, is there is a urgent, alarming need for this conversation to, I think, be carried on into all the other arenas of things that come into play here. Like if we're talking about, Austin, we just got done with this comprehensive sex ed fight where, Empower Texas brought everybody out to talk about how great, so for folks who don't know, Texas, we have some really interesting things in our textbooks that like our SBOE, or our State Board of Education, has deemed is good to teach children. We do not update it much. And so we are at that time and we're having a very knockdown, drag out fight about what should be included, because Texas is also a state that has a enormously high teen pregnancy rate, has an enormously high infant mortality rate, and maternal mortality rate when especially Black women are giving birth in the state. So, or Black people are giving birth in the state. Like the issue at hand is such a chain reaction issue that is just as important on a reproductive justice framework as it is within an HIV framework, as it is within just a general trans health framework. There is not one of these avenues that I would even say is more important than the other. These are all equally important. They equally work together when we're talking about quality of life and healthcare. When we look at what is it, you know, to have a good quality of life. And one of the like pinnacle things is your health. It is something that now has been monetized to, if you have more money, you have a better chance at surviving. You have a better chance at being able to address the health issues. You have a better chance of your providers having the knowledge that they need to be able to diagnose and address. And I think when we come down to it, like talking about universal healthcare in all of these conversations is necessary, because it is what we deserve as people who live in this nation. And I think like when we talk about it, that also means like reproductive justice is part of that. That means that abortion care is included. That means understanding and getting medical care providers up to a standard of understanding about trans bodies and LGBTQ bodies. That is part of it. All of this is part and equally important to when it looks like a comprehensive system that attends to the medical needs of the people that are part of this country.
Can I touch on something that somebody in the chat said that stood out to me and that I wanted to talk about today? So Micah said, speaking of birth control, the first provider I went to for HRT told me I had to have a hysterectomy before he prescribed me T. So the sterilization of trans folks is something that reproductive justice folks need to start talking about. We all know, well, maybe we don't all know, but state by state, so there are social transition, medical transition, and legal transition. And folks have all kinds of different preferences of like which ones makes the most sense for them. But for a lot of folks, for legal transition, so document changes and name changes, there are state by state requirements for like what you have to do in order to get your gender marker changed on your ID or your name changed. And like something like your ID, we know the gender-based violence that happens against trans folks in the country. So like having a gender expression that does not match your ID can feel really unsafe for people. So it's really important. In some states, like the requirements in order to change your gender marker or your name, some of the different requirements for even the type of healthcare that you can receive are dependent on, have you been on hormones, for how long, and sort of what we're talking about with hysterectomy and sterilization here are like in Kentucky, for example, my home state, there's a requirement if you want to change your gender marker in your name, like I don't think it's your name, but your gender marker, you have to have, I'm not even going to call it what they call it. You have to have a hysterectomy or a vaginoplasty. And you have to have like a doctor's note that you had that in order to get your name changed on your ID. That is like a medical assumption that all trans people want to have those types of procedures. That, first of all, is not true. Not all people, like, that doesn't feel affirming to all people. So what you have happening is like a forcing of a forced sterilization that in the moment, like I was saying earlier, people are like triaging their needs. In the moment, some people are willing to do that. Some people are willing to be like, okay, yeah, like this is really important. I'll get a hysterectomy, like whatever. But some people maybe later in life are like, it would have been really cool for me to have kids. Like that was something that I hadn't thought about at the time because I was in such a like state of survival. But now like the option has been taken away from me because there were assumptions made about what I needed to be a valid trans person or to be a correct trans person in the eyes of the government. So just wanted to like point that out, like that there is like still in 2020 today, like forced sterilization of trans people happening in order, like if you want, the medical system is saying and the governmental system says, if you want this thing, you got to do this. And that's not okay because trans people should be able to want to be parents if they want to be parents. There shouldn't be assumptions that when a trans person gets pregnant, they want an abortion. Or that like trans people don't want to get pregnant, so it's okay for them to get sterilized. That's just not true for everybody. So I just wanted to like point that out, like Micah, that's really messed up that happened to you. We deserve to go into a doctor's office and tell them what we need and get it. And this happens, unfortunately, to a lot of people.
Thank you, Courtney, for jumping in there. For our next question, I think a couple of y'all started touching upon this already, but what are what are the effects of the challenges that y'all named and having to navigate them have on the health outcomes and quality of life for trans, non-binary, and gender non-conforming people?
I want to flag that I really think intersex people should be named here. I think it's a really weak gap in where we intersect with our work too, with trans and non-binary, intersex, reproductive health, reproductive justice, sexual health, because when we talk about people who are probably in the most vulnerable states of having a non-consensual surgery, because even with trans people, unfortunately, as Courtney said, that triage of like, what is more pressing to my mental whole health right now? Is it that I can access hormone therapy, or is it that I want my options down the road to be able to do family planning how it feels good to me when it comes time for that. And that is like a basic, I think, thing that people deserve, period. People deserve to be able to have that ability over their lives. But when we talk about intersex people and bring it back, oftentimes, and I think in the US, one thing people don't realize is that it is perfectly legal. Doctors lie all the time to parents to have cosmetic surgeries on intersex kids that is stemmed in transphobia, because the second something deviates out of a binary body for us, we decide it's defective. We decide that's not okay. And like, instead of having hard conversations with kids about bodies and about bodies being different, we decide, no, we'll take care of that. We'll make you normal, just like everybody else, And like, one of the things that I've pressed against is like, for trans like advocacy, like I'm not here to tell you, like, we're just alike. You and me, we're not so different. And we're fucking different. I'll tell you that. That's a big part of the whole point, is that we're very different. And my difference and your difference also seem to collide. And so let's work together. And it's okay that, like, we're different. We're equal, though. So, like, let's accept that instead of, like, trying to placate to this, like, everybody conform to this model of whatever this is. And so when we look at the intersex fight too, of like, where does reproductive justice fall into that? Where does abortion care and like the organization and the advocacy that goes around that? For me, it's been a very frustrating thing to feel like, because sometimes intersex people are like, we don't want to be under the trans umbrella because it's not really our situation. Even though sometimes when that doctor who tells the parent at birth, you need to do this for your kid, and gets it wrong 50% of the time, then these intersex people end up having to transition. It is a whole mess. And I think like when we're talking about like the core root of the argument of around abortion care, we're talking about bodily autonomy. We are talking about the ability to have control, to understand when it is not a medically, like, life-threatening issue, to go ahead and make that kind of a decision, even for your child, I think is reprehensible. Like, you want to talk right now, like the, Texas Republicans are talking about forced sterilization on children because that's what they think about trans kids, even though that is not at all what happens. Forced sterilization is actually what Republicans want with intersex kids. And I don't mean to be partisan here, but like in the sense of how we've watched like the legislation and initiatives where intersex people are like, this happened to me and it is awful. Can you imagine this happening to you? Can we not just make it illegal? And they're like, no. That's too much. And so I think like looking at that too, of what is that complication? Because people don't even understand, I think the very basics of needing to understand intersex bodies. And so that is I think an entirely huge challenge in and of itself within sexual health, within reproductive justice, within this conversation.
Thank you, Emmett. I want to appreciate you for naming that, and we'll continue to include intersex folks in the remainder of the questions. So, y'all have talked about a lot of challenges. What have trans, non-binary, intersex, and gender non-conforming folks done to take care of themselves and their people amidst all of these challenges?
Go ahead. I'm always hyper aware. I do not want to be the man like going first all the time.
So, I think something that's being done in the Birmingham community that's been going on for a long time before I was ever aware of it, and have limited, right? And as a cishet person coming from a extreme place of privilege, one of the things that has been super helpful, we have the Magic City Acceptance Center, right? And there's a branch of that is specific to healthcare. And so in terms of holding the providers that I work for and the folks that I work with accountable in terms of, yes, we're going to be diligent in providing good care, is working with those that specific organization, so that we know as providers that anyone we refer out to any other services that is not, gynecological or OB care is going to be accepting of our patient and of our client. And so being able to work within that network, I think, has been not just beneficial for those folks, but it's extremely beneficial for us in terms of making us aware of who the other providers are in our community that we can work with, and how we can build a better care, right, holistically.
I would say we're getting like all up in this field. Like trans and gender nonconforming people and intersex people. I'm cautious to name intersex people specifically because I have not done work and research with that group of people and don't want to say stuff that like I don't know. But are becoming midwives. Like there are like so many community support networks of trans folks becoming midwives, becoming doulas, infiltrating Planned Parenthoods, and just sort of like agitating from the inside. Like that from my perspective, that's what I know that's happening. Definitely self-managed abortion is one of those options for, I think, people like trans folks, people who are undocumented, people who are poor, people who, for whatever reason, mistrust or don't have access to the healthcare system. So I think that is like when there are trans and gender nonconforming folks going in communities and doing self-managed abortion trainings, being a source of support for people for that. Yeah, that's my answer.
On my end, I definitely agree with Andy. It is actually really perfect to what my response was going to be. Trans-led orgs so for folks that don't realize this, 4 cents out of every $100 that comes into LGBTQ advocacy comes to trans-led orgs. So 4 cents out of $100 that comes into the LGBTQ advocacy world comes to trans-led orgs. So for folks who are not part of like the LGBTQ community and do have awareness of how messaging works there, I think one thing that you cannot deny is, even though that is the monetary sense of the support we get, every single org that's LGBTQ anything is like chanting about trans lives. But where does that really, where's the equity in what's happening right now, given that we're also tasked with having to move things forward? Organizations like OLTT that Andy mentioned, that was started by an undocumented trans woman. Like, I think when we talk about like the risks of like what our advocacy sometimes unfortunately looks like, this is part of this conversation, because nobody was doing, her, people that look like her, people that she cared about, and she knew were being impacted. And at what point do we say, I'm not going to wait for a seat at your table. I'm going to build my own table. And when I make enough noise, then like, you'll probably come around and want to talk to me. And like, this is what it is. And I think that is the reality, unfortunately, of where we're at. Realizing for me, I stand on the shoulders of a lot of trans folks before me. And now, for me, for Tent, where we're at, we are, we assisted with a community pride clinic in San Antonio, where it is a program through the University of Texas Long School of Medicine in San Antonio, where the medical doctors who are going through their education, doing their residency, are overseen by the doctors who are teaching and practicing. And for trans people who are uninsured, they go into that clinic when they have the open hours, which I think is twice a month now, started at once a month. And we made sure that when a person comes in there, from the very greeting that they get to the last goodbye they have, that there is not harm happening from somebody, even though they are learning, they're there to learn about how to care for people, not how to just basically treat people with decency and dignity. So taking those parts of it out, but also addressing everything is free. You go in there and like even to the hormones where they give you HEB gift cards and try to estimate what your prescription costs are gonna be is provided. And at the same time, we're training up new doctors who are gonna go out throughout the entire country who now have hands-on experience, who now already have a leg up on that competency, who already have dealt with patients, and we're replicating that around the state of Texas now. But one really exciting thing, I think, when we talk about that is we're also pushing them through their School of Medicine to incorporate an entire like teaching track about trans health, and like incorporating and pushing for that to be part of their training, their education, because they want to learn about it, because they want to be able to do it when they become doctors. And we want that to happen because this is the, you know, part of the solution. The other part of things that I see where we're like changing things is, along with I am the co-director for Texas's PCORI project, which is a patient-centered outcome initiative. And essentially what we are doing is we are doing well, it's a lot of projects and also one big project at the same time, where we are essentially getting data on the trans community in a way that we've never seen it, in a way that Texas has a population that does reflect the rest of the nation. And we're looking at that. If like we have an overwhelmingly like white participant pool, and we're talking about trans healthcare, we're not doing a good thing, right? So like taking all of those steps, all of those measures from like the very like ground up to how do we gather this information, I think is also a piece of this. When we talk about how trans people are having to basically push into this to understand on the part of, or to make the, provider end, to make this system and be a system that works for us, that sees us, that recognizes us first, like with dignity at a very first baseline point, and then takes it from there. And so I look at work across like the country, and in Tennessee, like you have My Sister's House, who is a organization led by Black trans women, where she bought a house to literally house like other Black trans women, and now they make like care kits that like have Narcan, that have like, you know, these things that community needs and doesn't even know how to access. So I think when we look at it, like in the whole scheme of things, I don't think, you know, for trans people, we're going to find our answers in the system. We're going to find our answers by changing the system, by permanently changing the system, and by insisting that any other thing outside of change is not an option.
Thank you, Emmett. Moving right along, if trans, non-binary, gender non-conforming, and intersex folks were given a seat at the decision-making table to shape their own sexual and reproductive healthcare provision, recognizing that this community is not a monolith and that intersectionality plays a role in material conditions and needs, what would we want the system to look like in order to better serve us?
So there are the answers that are like the results of my research project. And then there's like the radical in me that's like, I want us to take care of one another. I want us to have what we need to just take care of one another, and like chuck the healthcare system. It's like a sin for a public health person to say, but like in an ideal world, if I could make it how I want it, we wouldn't have that healthcare system to depend on, and we would have what we need to take care of one another. One part of that I know Emmett and Emma, y'all have really good answers to this question too, but one part of it that like I want to be sure to lift up is coming from a rural mindset and a rural space. I grew up, and my chosen family grew up being told, if you want any sort of good quality of life as a queer or gender nonconforming person, you got to get out of here. And that's complicated when you love a place. And so in an ideal world, like all of these programs and projects that we're talking about, and like when I was in Seattle that I learned about, are like great and amazing and are like going in a really great trajectory, but are really impossible, if not completely impossible, for rural trans and gender nonconforming folks to access. So I would want a world in which like my chosen family members don't have to have jobs where they need to be able to take 2 days off of work to drive 4 hours to get their hormones, or to have whatever sort of healthcare they want. I want them to be able to live where they want to live and live the life that they want to live and have access to what they need there. Yeah.
Yeah, I just want to piggyback off of what Courtney's saying. Agree. One of the things, working specifically within the context of maternal health for my job, as my job and my research for my degree, et cetera, right, those same struggles in regards to access to maternal health care, and that all kind of should be brought together. Our group started a quote unquote satellite clinic in Tuscaloosa so that pregnant folks could give birth with us in Birmingham, but if they live in Tuscaloosa, right, they can get prenatal care there. So theoretically, the only times they would need to come to Birmingham would be for their initial ultrasound, dating ultrasound, anatomy scan, and then to give birth. But that's still, right, that's still an hour drive, right? And that's pretty prohibitive. And then we've recently seen an uptick in folks who are coming from the Demopolis, Selma area, which is a 2+ hour drive. And so to just kind of continue to build, right, this is something that harkens back to what Emmett said at the beginning of our chat in regards to like in these southern states where like cis white women have trouble accessing, and then that highlights, right, the degree of which other folks don't have access to hardly anything. Yeah, it just, everything you said.
I think for me, you know, the Pride Center, the Community Pride Clinic in San Antonio is a good, I think, framework for a stepping stone. But I think when I think of good, like what does this sort of like perfect, equitable, respectful healthcare look like, is to also get past that and have it be normal that there are trans doctors. You know, for me, I have a friend who is extraordinarily smarter than me, but holds a PhD in psychiatry and is now at Mayo Clinic finishing his residency for his MD, and he's trans. So when I think of that, that is what I think of. For that to not be a unicorn kind of story, for people to not look at me like I'm shocked, like they're shocked to hear that. And I think like also another thing to point out is to, to say, you know, we're going to have Black trans women as doctors, and that's not going to be like, oh, like, you know, she walks in and is there to, you know, be a provider, and you know, there's not a reaction. So like, to me, I think when I look at it in that sense, like, what does it look like to have gotten past where we're fighting to just be hanging on to the fringes of society, as opposed to that road has been traveled and we are in positions where we're present and we're visible, and it's not, visibility does not equate to a target because of transness. And so for me, like, that's what I think, because who are you going to listen to? You're probably going to listen to your colleagues. So if we have people who are trans, who are doctors, who are practicing side by side, like, that is going to naturally provide a better system, a better healthcare landscape, a better insight into what this all looks like. And, you know, I think one of the things for me, I'm glad that we're like pushing the conversation past equality into talking about equity. But I think for where I'm at is also that people need to understand that equity is a stepping stone to liberation. Liberation is where that goal is. Because if you have a system that needs equity, you still have a broken system. You still have people that are getting screwed in that system. And so we cannot just rest on like getting to equity and saying it's equitable, everyone has a fair shot. Well, how about now like progressing past that and saying, what does it look like to have a system where people just naturally have a fair shot? And so I think, you know, and that is a very, you know, pipe dream for me, and like what keeps me in this work and keeps me pushing forward is knowing we will get there because we do not have another option.
Thank you all so much. So we have made it to the final question in the panel, and we want to know what some examples of really good, equitable, and respectful healthcare for trans, intersex, non-binary, gender non-conforming folks is.
I think Emma and Emmett have mentioned some specific examples in their communities. One thing that I wanted to say is sort of connected to the previous question, and it's like the public health answer to that question, is abortion clinics that are moving to also provide gender affirming care outside of gynecological care. So like providing hormone replacement therapy in abortion clinics. I know as far as like when we talk specifically about the intersection of trans people accessing abortion care, like that is one of the things that has been talked about that would make it safer and more affirming for trans folks to come into abortion spaces, because as Emmett was saying at the very beginning of this, if it's an abortion clinic, especially if it's one of the ones that's like Alabama Women's Center, and somebody whose mask comes in, like that is likely an uncomfortable situation for that person, and everybody else in there like don't know what the fuck to do about a masked person in an abortion clinic. But I know in the Northwest, Planned Parenthoods and abortion clinics have started to have, like, there's clinic day for abortion procedures, and then there's trans healthcare day for when everybody comes in to get their HRT or like other healthcare services. That is a model that I think could be better. Like there was still a disconnect even with staff, that the same people who are coming for HRT might also come in for an abortion. And so making the division between those two sectors of healthcare, even though they're happening in the same building, like less, like blurring them a little bit more. And it also, like the people that I talked to, it helped to know like the same person that the same providers and faces that they've been seeing to access their HRT, if they find themselves in a pregnancy crisis or with a potential STI, they're going to be a lot more comfortable going into that same exact clinic that they're going into already for their HRT to get whatever it is that they need now. So I think that is a good model that can be improved, but like, I like that idea because something that we've already said, abortion care is highly stigmatized and politicized, and so is trans healthcare. And so if we want to be smart, we're going to get together on that and take care of one another, because we're not two different sets of people who are experiencing that violence.
Emma and Emma, anything you'd like to add to that?
Yeah, I'm not 100% sure, just coming from my own personal perspective, and something that we do with pregnant folks at our clinic that we have not been doing because of COVID and the limitations surrounding that is we're one of the only places in the state, as far as I know, that provides group prenatal care for pregnant folks. And we know that that is a huge, it helps with birth outcomes, especially specifically women of color, Black women, that group education, owning that information, taking that on, that model, right, is incredibly successful. And so it seems like I don't know if that model could be successfully applied to, especially for those of us in a situation like I'm in with my clinic where, where we're very limited in our education and resources, and just in terms of educating our staff and educated more of the folks around us in regards to what care should look like and what care, what folks want care to look like. That might be a strategy to help improve things going forward. I don't know, but yeah, that's what I've got. That's what a lot of Courtney's comments got me thinking about in that regard, just to improve and put us ahead of where we're trying to go specifically for the clinic that I work at.
I think right now, part of the issue is that we don't have really good framework for what this even looks like, because that's so, again, I think we go back to the reality of the situation is we're very far behind. And so I think we're in this moment where we get to kind of push for what we need, especially because it's so long overdue. We're seeing, older trans adults now who are approaching senior age or into senior age who are coming up with kidney disease. And why? And it goes back to transness. It goes back to, this whole restroom debate, I think kind of makes me giggle a little bit in a sad, sad way, because I don't even like to use public restrooms. I don't know anybody who likes to use public restrooms, but like, I'm a germaphobe and I really hate using public restrooms, but on top of the transness thing, like, it's just a no-go. Like, this is what it is. If I'm in a public restroom, like, the other alternative is something none of us are gonna like, because that is a last-ditch option for me. And so when we think about it in that sense of like, what are these other like underlying things that have now culminated into really like kind of overall public health issue for trans people, there are all of these different things to consider, and also to consider geography. Like, I grew up in an area where I think we had more corn stalks than people by far, by 10 times far. So thinking about being in that area and like, what does it look like to find a doctor that can actually address all my health needs? You know, Toledo is the like closest city to where I grew up, and I don't know if anyone's ever heard of Toledo, but I wouldn't call it a city really, but it's the largest place where more people are. And so a lot of people in that area have to drive like an hour and a half, 2 hours into Michigan, where University of Michigan is, where they have trained people in the Ann Arbor area who are doing this. But what is a 3-hour round trip commute to get some freaking like hormones? Like, come on, you know? And so thinking about all of that, somebody put OH, and I went to University of Michigan, and I'm just gonna say I take deep issue with that. But you know, what does that look like in a fullness of a picture, where we have to not only look at what would creating an equitable system be in terms of health issues that have gone unaddressed, that we're now learning about health issues that we need to anticipate in terms of, you know, how is HIV going to really impact the trans community? How has it impacted before? And no one would look at it because trans women get like classified under MSM, which indicates that they're men having sex with men, where you have like a whole system that's already in place where like we can't even get forward motion on like HIV, who has money now to recognize us, recognize we exist. That is it. That is the ask on that. And so when we're not looking into that, then what does this look like in a full picture? And I don't know. I think it comes from municipal funding through like public health. It comes through you know, federal funding. It comes through state funding. And when you're looking at states in the South, what does that look like? And if you're looking at like what this election's going to look like, you know, so many variables that I think when we look at that, it's up to us now to create that system together, informed by reproductive justice experts, by sexual health experts, by HIV experts, all of this, but like comes from the community that has been yelling and screaming and finally is starting to make enough noise for those pieces to come together in a way that makes sense and translates when a trans body or a body that goes outside of like cisgender being looks like when sitting in an appointment. What does it take to even get them into the appointment? And then what does it take for a medical provider to know what to look for? So trans people aren't having to hold our doctor's hands based on the Tumblr like post that we read. Like, I'm sorry, but like Tumblr is great, I guess. I got a kid, they seem to like it for a hot minute. But I don't really want my doctor to be Dr. Tumblr. So I think like looking at that it's a whole question, like a whole landscape shift.
Whew, thank y'all so much. Panelists, so Courtney, Emma, Emmett, that has been a long 1 hour panel. Do you need a minute or two to turn off your screen and take a stretch or take a drink? Or are we good to dig right into the Q&A? Awesome, thanks y'all. So thank you, Kathleen and Nigel, for compiling some of the questions in the chat. I thought we could actually go ahead and start with Anna's last question here in the chat, which is, how can we better support transgender, non-binary, non-conforming, and intersex folks without a uterus within the RJ and abortion fund world?
I think there are different answers. There's an answer for the RJ world and there's an answer for the abortion world, because RJ is not just abortion, thankfully. But so within the RJ world, I'm curious what thoughts folks in this space have, like sort of like what generative thoughts people have. My initial thoughts are sort of along the lines of some of the things that we talked about as far as sterilization and assumptions about like the kinds of sex that people are having and what that means about their sexual behavior and their sexual risk factors when we're talking about RJ specifically, and like trans femmes and TGNC folks who don't have uteruses deserve, like within the RJ framework, they deserve to have kids if they want to have kids. They deserve to not have kids if they don't want to have kids. They deserve to have bodily autonomy and access to whatever healthcare, whatever it is that they need to have a happy, healthy life. They deserve access to all of that stuff. And so I also think another part of it too is making space for the fact that in the sexual and reproductive health space, there are partners coming into that space. So like there could be trans femmes or like TGNC folks who don't have uteruses, like coming into those clinic spaces with partners, with family, with friends, or themselves seeking care. And so like an understanding that like breaking down the cis heteropatriarchy of like how relationships and how sexual behavior looks. That's my answer for RJ. I'll let somebody else take abortion funds if they want to, but I can brainstorm on that too. I'm also curious, like what people in like what y'all think, like how we as a collective community can better support TGNC folks who don't have uteruses within both the RJ and then the abortion space.
I know for me specifically, one of the things that I'm not starting to run into, but have run into, and that needs to be continually addressed in the kind of the medical aspect, clinic aspect, working aspect, is just the education piece of with all of our employees as to regardless of whether you have a uterus or not, this is a space to come into for anyone, right? Like the OBGYN suite in our clinic, anybody can come into that space and request this kind of care. Like it does that. And so that's, for me, I know that's a challenge in terms of trying to help educate and break down and shift culturally a lot of long held beliefs with coworkers that folks have a right to this space. So I know that's kind of an ongoing struggle and doesn't really address the question, but yeah, that's an ongoing, that's where I am in that particular piece. Is just making an effort to tell folks, yes, you belong, making an effort to tell my coworkers, yes, these folks who are coming in seeking care are here and this is their space.
So this the question also really kind of feeds into, I don't think this is an RJ abortion world specific issue, first off. I think when we look at it, the people who are actually the most guilty of this being a trend is actually LGBTQ. When we look at the LGBTQ work, going back to how is that work usually done. I think we're seeing shift where, you know, post the like Great White Awakening in America that happened a month ago to racism, we also are seeing movement within the trans community, right? Where all of a sudden, like even within cis queer spaces, where there has been like this like new sort of like come to Jesus moment, whatever you want to call it, that we're not doing enough with like trans people. We're not doing enough with Black trans people. We're not doing enough work that means something, that is actually creating impact, that is actually improving proactively quality of life there, lessening harm. And so when I look at that, I think one of the issues that we come up against is even within the like landscape where trans people are supposed to be like sort of like a part of, we still deal with the same issues of trans people being an afterthought. A lot of the issues that like we're talking about are like very much like will disproportionately impact trans people even over queer cis people, in senses of abortion and senses of certain like I guess higher rates of infection for certain STDs, STIs. And we're looking at what does it look like to lump two very different but very similar people together in a community and assume that even though by nature one is sexual orientation of like who do you want to go to bed with, and then like one is you know, gender identity as like who are you when you go to bed. And so those are different things. And so I think we failed on that measure from the get-go because like, you know, we have 50 years now and like all of a sudden like the white cis gay community is like, oh yeah, like Marsha P. Johnson, like, you know, all of this stuff. And like they're just learning about like, you know, Compton cafeteria riots. They're just learning about like so much fundamental movement that happened that was very much spearheaded by Black and brown trans folks, trans women, and a lot of like situations. And then when we look at like, why do movements happen, right? Why do protests, like, what is this, right? It is because a population of people has been so pressed against the wall. What does it take you to explode out into the streets? What does it take to push a whole entire population to a point of breaking, literally, and saying like, we're not gonna stand out here and get murdered. We're not gonna stand here and be used so cis queer-led orgs can raise money off our like trauma. Like this is enough. And I think like the same things that are happening now finally within the LGBTQ landscape will slowly, I think, translate over to these spaces. Because, you know, just to be quite blunt, I think BIPOC trans people, Black trans women, like it's been enough. Like this is enough. Like to sit here and like just have a circular conversation that never produces anything in terms of seeing people be lifted from that space, people be progressed from a space of being, you know, attacked to the fundamental core of who they are in every aspect of what allows people to be secure by having a job, by having a secure home, by having good healthcare. Like these are things that are fundamental to survival, let alone progress, let alone success, let alone what does it look like to get out of survival and into being able to succeed. And so I know it's not a perfect answer. I hope it helps you. But it really comes down to this necessity for the movement that's spearheading it to recognize and change and make sure that we are doing due diligence to support that change in the intersecting issues that impact us, that include us, that affect us.
Thank you all so much. Just a reminder for our panelists to please not use acronyms so that we can better support our friends at the Rio Grande Valley Language Justice Collective. Moving right along, so how has the reproductive health rights justice movement shown up for transgender, non-binary, gender non-conforming, and intersex people? And how would you like to see advocates from these movements show up if they haven't already?
I think it's, I mean, in the same line of what Emmett was just saying and the question that Anna raised, I think reproductive health rights and justice work is on its face, outwardly facing, trying to start including LGBTQ and trans and gender non-conforming people in the work that they do, and like finally recognizing that the work that they do affects those people. I will also say, like, the reproductive rights movement, the reproductive health movement, and the reproductive justice movement all move pretty differently. So I will say, though, that from my perspective, even the reproductive justice sector is not doing well enough to like really do the work and really like move with trans and gender non-conforming people toward reproductive justice and what that looks like for them. Sort of like what you're saying, Anna, like that, yeah, there's messaging that's like, oh, and trans folks get abortions too. But it sometimes too often is stopping there and like not actually having conversations about, and how do we support those people in their pursuit of abortion access. So, I mean, it's really in line with what Emmett was just saying. Like, we're at a place where people are starting to talk about it, but we, in my opinion, have a long way to go. Like, we should be talking about the sterilization of trans folks and what it means, what transparenthood means in our current like climate. Not even in our current climate, like what transparenthood means, period. Like I have not seen reproductive justice organizations talk about and do that work. It's more of a like messaging of like trans folks are included in this. But it's like stops there.
I think so. One of the things too that we're up against, right, where I see it. So I have a child who has just turned 21 at the end of April. My Asian genetics, I think, shock people when I say that. But the the circumstances that I had my child. So I had my child very young. It was a situation where I was sexually assaulted right before my senior year of high school. I did not know, much like Courtney said, where there were not this like signs, so to speak. And also, as you're all aware, after sexual assault trauma like that, it messes with your body's sort of biological system of all of that. So for me, not being sexually active at all at that point, I was really down with the big JESUS at that point. You know, I mentioned I lived in cornfields, right? So when you're a kid, you gotta like get along to survive sometimes. And so there I was in this situation, and very much still who you see today in a lot of senses. And so that definitely like just appearance, like I had not come out as trans, but like that in of itself was definitely like made me apprehensive to even go talk to somebody, let alone report it to the police, let alone report it to a medical care provider, where I knew it would be a very invasive test. It would be extremely like hard on me individually, not just because of what had happened, but because of who I was. And so why I say that is because now, you know, when I talk about my family, people are very confused. And it is always very interesting to see kind of the reactions where like people are like, oh, trans people can have a family. That's weird. I just thought they were like floating around in like the universe, like just transing along. I don't know what the like mental picture here is, but they seem very genuinely like surprised that like in a lot of ways I'm about as boring as I look, with, you know, a light blue button up and all. I have a very light blue button up kind of aesthetic to who I am. But it, you know, that in of itself, when you see that jolt of like, what? Like, oh, I'm trying to like wrap my head around this. Like, you can actually have a family. Like, that is a big disconnect where like we're so far from even like having conversations of like, then what does it look like for family planning for trans people? Then what does it look like for the possibilities of even like being able to access that family planning sort of like medical support? And you know, to the like reproductive justice, abortion care landscape, you know, I don't know if folks have ever heard of RFIA, but it's Reproductive Freedom in Action. It's a sort of like weekend-long conference that the ACLU of Texas does, and they bring like medical, I think like law students, like people that are in college and like heading into professions where they can really impact the issues in where they're heading in their field. And I was invited to speak on a panel, and this has never happened to me before, weirdly, by somebody who's like not there to like specifically troll trans people, where someone who is known very well within the like reproductive like justice landscape in Texas literally stood up, interrupted me, told me I was wrong about the issues I was talking about. I was not wrong. It was very much, it was about our legislative session, and like pushed back on me very hard. And then like ended it with like, you know, LGBTQ people are just trying to get in these spaces they don't belong. And like, I think that is spot on, right? Is like, there is a very like sort of old, like establishment sort of, this is how it's been done. And like, as like now we see the evolution, we see it opening up to realizing like, this is an issue where so many other people are affected, can be on our side effectively of this, where because, and I think it shows up in states like, you know, in the South, where like this is high pressure at scarcity model, where like there are so many funds to go around and someone is on the chopping block. And then we get into this like space of like, this is yours and this is mine, and we cannot work together because we feel like, you know, one issue gets screwed for the other, instead of figuring out how do we basically both not get screwed, you know?
Thank you. I'm going to step in here. So we have around 4 minutes left, and I want to ask one more quick question of the three of you. What is one tangible way that communities can support transgender, non-binary, intersex, and gender non-conforming folks navigating healthcare systems?
Can you repeat the very first part of that question? I'm so sorry.
No worries. What is one tangible way that communities can support transgender, non-binary, intersex, and gender non-conforming folks navigating healthcare systems?
If we're not in the room, bring us in there. If we're not in the room, just bring us in. Like that's, I think the ask is, if you see that and you're working on something, just bring us in. Like we are happy to be there and we need to be there. And so for conversations where it keeps on like bothering you, like somebody should be in here to be able to speak to this a little bit deeper so we can do this work better. Bring us in.
I would say it's great to critique all of these other things, and we should always be doing that. But for people who want to show up for TGNC folks, I would say disrupt and undo the gender binary and transphobia within yourself, and recognize how that colors every single part of your day, and how, because like that's how trans and gender nonconforming people move through the world. Like they're seeing it everywhere. So yeah, maybe you don't have power over what happens at the clinic, but you have power over like what you believe to be true about trans people. And when you gain that understanding, you can share that with the people in your community that you're in deep relationship with. And I believe that's what has to happen for us to be able to get these like larger systemic changes. Like people really don't understand trans people and like what they're about, and like they clearly don't know what kind of sex, like all the different kinds of sex that trans people are having, and that they can have kids and they can have families, and like all of that stuff impacts us to have to explain it all the time. We don't always have to be in the room telling you what's right and what's wrong and what's transphobic and what's not transphobic. Like you can learn that and then teach the people around you. I think that would be really helpful.
Within the space that I work, where I echo what Courtney and Emmett have to say.
Courtney, Emma, Emmett, thank you so much. I'm so grateful to have had the chance to sit on this panel with y'all and to listen to your expertise and knowledge. I know that I and a lot of us on this call took a lot away from what you've had to say. So thank you so much for spending part of your Saturday with us. Folks in the audience, feel free to express your love and thanks and gratitude in the chat for our incredible panelists. I'm going to hand it on over to Danielle to close us out.
Hey folks, it's me, your favorite disembodied voice. I just wanted to say thank you so much to, of course, the panelists, all of the URGE staff who have made this panel and also like all 4 of these panels run really, really smoothly. And of course, all of my thanks is for the attendees, for y'all showing up, many of y'all showing up for all 4 sessions, which is like not an insignificant chunk of time. So thank you so much. Also, of course, to the Rio Grande Valley Language Justice Collective for hanging out with us for 4 days, for also hanging out with us tonight, and helping us on our journey towards increased accessibility and inclusivity and language justice in general. So our last event is tonight. We're having a party. So we will have performances from Chocolate City Burlesque. And we will also have a DJ whose name I don't have on me right now, sorry. But it will be an opportunity to celebrate and also support folks who are Black and brown sex workers, Black and brown queer and trans folks who are doing sex work, and just generally a great time. We've worked with Chocolate City Burlesque specifically many times. Urge loves them, and Urge loves them for a reason. So that'll be tonight, starting at 8 Eastern. I can't do the rest of the time zone conversions in my head, y'all, but it starts at 8 Eastern. And it will also be on Zoom, and you will absolutely have access to all of their Cash Apps, Venmos, etc., for an opportunity to show them some love. That is all I have. Thanks again to all of y'all. And hopefully I will see y'all tonight. Bye.